Good morning. I'm Marcus Plusha, the chair of the National Forum for Heart Disease and Stroke Prevention, and I'm also the chief medical officer at the Association of State and Territorial Health Officials. Welcome to the 2024 annual meeting. Today's meeting centers around the theme, Advancing Health Equity Throughout America, Novel Data-Driven Approaches to Cardiovascular Health. It's been an honor to serve as the chair of the National Forum for the last 2 years. And I'm pleased that the National Forum has continued to increase and document its impact on cardiovascular health and health equity. The National Forum was recently honored to receive the Association of Black Cardiologists' Spirit of the Heart Award. The Association of Black Cardiologists produced a video for this awards, which was shown at the awards gala. And we'd like to quickly show that video as it gives several examples of our impact.
The National Forum for Heart Disease and Stroke Prevention is deeply honored to be selected by the Association of Black Cardiologists in receiving the Spirit of the Heart Award. Co-founded in 2002 by the Centers for Disease Control and Prevention, the American Heart Association, and the Association of State and Territorial Health Officials, the National Forum's mission is to spark and lead collaborative action to achieve health equity and optimize cardiovascular health and well-being throughout the lifespan. The National Forum is comprised of more than 100 member organizations representing the public, private, and nonprofit sectors. The National Forum pursues its vision that people throughout society live heart-healthy, stroke-free lives by fostering collaboration among the most dynamic and diverse organizations in cardiovascular health to share successful strategies, practices, and lessons learned, discuss new ideas in collaborative environment, develop, pilot, and scale innovative approaches to prevent cardiovascular disease. The National Forum's major initiatives, in which ABC has provided leadership on and is a valued partner, include the Value and Access Collaborative, a multi-sector collaborative bringing together patients, providers, payers, purchasers, public health, and pharma and biotech, supporting people's access to evidence-based care that is appropriate for them. In 2021, the Value and Access Collaborative developed policy recommendations to expand access to evidence-based care provided by pharmacists. Between 2021 and 2023, 32 states enacted 75 laws aligned with the policy recommendations. The Value and Access Collaborative also develops shared decision-making guides to help healthcare providers engage in conversations with patients about treating and preventing cardiovascular disease. The Mayo Clinic found that guides on FH resulted in a 50% increase in patient engagement. Over the past decade, through its Move with the Mayor initiative, the National Forum has mobilized a network of more than 200 mayors to encourage active, healthy living and strengthen individual and community resilience. Mayors use Move with the Mayor messaging, program policy and infrastructure recommendations, and other tools to empower and protect community members from health threats and improve cardiovascular health, mental health, and health equity through co-branding partnerships on initiatives including Move with the Mayor, Know Your Numbers, and Community Pharmacists. The National Forum collaborates with clinician partners and members to amplify information on important health issues impacting cardiometabolic health, including physical and mental health, vaccination, and patient-centered, team-based care. These paid social media ad campaigns exceed national engagement benchmarks, reaching community members far and wide. The National Forum looks forward to continuing collaboration in 2024 and beyond to advance policies and systems changes that improve cardiovascular health, overall health, people's well-being, and health equity.
As we look to the next 2 years and beyond, the National Forum continues its thought leadership role in empowering all of us to help people throughout America understand that health equity benefits everyone. This meeting is part of that initiative. Before I introduce our keynote speaker, here's our Executive Director, John Clymer, with some announcements.
Thank you, Dr. Plesha. Good morning. Here are a few ways to help you maximize your engagement and takeaways from today's meeting. Please use the chat function to comment on the meeting topic, panel discussions, and share information. Helpful tips and links will also be included in chat. Use the resource feature to access the program book with the agenda, speaker bios, and more. Use the Q&A feature to ask questions. Please submit questions at any time. Following each panel, we will have a Q&A session during which our panelists will respond to as many of your questions as time allows. When sharing key points from the meeting on social media, please use the hashtag #NF2024, NF2024. Panelists' X or Twitter handles will appear on screen and are in the program book. Closed captioning is available, and you control how it appears on your screen by using the CC button on Zoom. Today's meeting is being recorded. If you have colleagues who can't be with us right now, they can catch the whole meeting on demand next month. When the recording and meeting summary are posted, the National Forum will send you the link. This convening and your no-charge participation are made possible by our generous sponsors. Thank you to the American Heart Association, American Pharmacists Association Foundation, Boehringer Ingelheim, and Regeneron. Toward the end of the meeting, National Forum voting members will elect Board of Directors members and take part in a very brief business meeting, and the National Forum will present awards to individuals and organizations who have made exceptional contributions to improving cardiovascular health throughout society. Now, Marcus, back to you.
Great, thanks, John. So now we move on to an important event in our agenda, our keynote address and keynote speaker. And it's my honor to be able to introduce our keynote speaker. Admiral Rachel Levine is the Assistant Secretary for Health and the head of the U.S. Public Health Service Commission Corps at the U.S. Department of Health and Human Services. Dr. Levine is a pediatrician who previously served as Pennsylvania's Secretary of Health. I go on to say Dr. Levine is also the former president of the Association of State and Territorial Health Officials where I work, so I know her very well from that role. She took on that role as president at the very beginning of the COVID pandemic, and I really remember very well Dr. Levine's leadership and really instrumental support during that time, and that's leadership and support that she's definitely taken with her as she continued in her leadership role in federal government. So Dr. Levine, thank you for joining us, and thank you for being our keynote speaker.
Hello, and thank you for that wonderful introduction, Dr. Plesha. Congratulations on a successful 2 years as chair of National Forum's Board of Directors. I am pleased to address you all at the 22nd Annual National Forum meeting. The topic we have come together to discuss is one that is so important: cardiovascular health and the role of the vital conditions that impact heart health and overall well-being. Heart disease is the leading cause of death in the United States for men and women and people of most racial and ethnic groups, but it can often be prevented. Encouraging individuals to live a healthy lifestyle can help prevent heart disease. This includes promoting healthy lifestyle habits, such as choosing healthy foods, maintaining a healthy weight, getting regular physical activity, not smoking, and working with health professionals to manage medical conditions such as high cholesterol, high blood pressure, and diabetes. These recommendations are easier said than done for individuals who do not have access to healthy options. Every person deserves the opportunity to live a full, healthy life. Healthy People 2030 defines health equity as the attainment of the highest levels of health for all people. And I firmly believe that we have not made progress unless we have all made progress. Achieving health equity requires that intentional work. That means making focused and ongoing efforts to end inequalities and the impacts of contemporary injustices, to eliminate disparities in health and health care, and improve the health for everyone. To achieve wellness, we have to do more than think holistically. We have to work holistically. In that spirit, I want to share an approach we call the People and Places Thriving Initiative. The initiative takes a holistic approach to human needs. As I have traveled across the country, I have seen the ways in which issues beyond the immediate scope of the United States Department of Health and Human Services influence the health and well-being of the people. Communities need more reliable transportation. They need more humane housing. They need more access to nutritious foods. They need economic justice, environmental justice, and climate justice. They need a greater sense of belonging and empowerment to effect change within their communities. Improving our nation's health and well-being requires addressing all of these needs. People and Places Thriving is a vision and an operational roadmap to build connections and support people in all ways that matter to them. It is not focused on new resources. It is about focusing on needed solutions and then pointing existing resources towards these solutions to maximize our combined impact. It is an evolution of the concepts we have often referred to as the social determinants of health. It shifts the focus away from limitations and restrictions for individual programs to focus on the totality of the capacity and capabilities that we have at the federal level and all other levels of public sector systems. It involves the full depth and breadth of the federal government. It creates a structure that leads to a shared vision and complementary actions across multiple departments. The framework is rooted in the 7 vital conditions for health, well-being, and justice that people depend on to reach their full potential. These vital conditions are the building blocks of a healthy, thriving society. We are seeing the power and value of the framework across many communities and systems. At the heart of vital conditions is belonging and civic muscle. This emphasizes the importance of healthy relationships and strong social supports in fostering thriving communities. It calls for federal, state, and local governments to collaborate with community members to strengthen community assets, connections, and values. The importance of inclusive belonging and strong civic engagement cannot be overstated. These are crucial elements in promoting resilience, strength, and equitable response within our communities. We must prioritize the development of local infrastructure that supports civic agency, collective efficacy, equitable access to information, vibrant cultural opportunities, and unwavering support for civil and human rights. Embracing and nurturing these values will lead to a more cohesive, empowered, and just society for all. To pave the way for equity, we must unite community leaders and advocates to act based on a shared vision of change. The National Forum's Move with the Mayor initiative mobilizes mayors nationwide to strengthen the vital conditions for health and well-being and justice in their communities. Through Move with the Mayor, elected leaders are empowering people to effect change in their own lives as well as their communities. These mayors are implementing evidence-based policies, programs, and environmental changes that enable people to thrive. Local elected officials are at the forefront of health leadership, and their actions significantly impact the well-being of citizens. They play a vital role in locally promoting community health and well-being, leveraging resources and networks to achieve health goals. Through public-private collaborations and national and local movements, HHS is working to actively achieve connections between public health and the vital conditions of health. That spirit of community is what makes our country great and is what we need now more than ever. All Americans deserve the opportunity to achieve optimal health and well-being so that they can thrive, so that our communities can thrive. We can do better. We must do better. And with your help, we will do better. Thank you.